You've probably heard a lot of buzz about Ozempic and the other GLP-1 medications. It seems like everybody and their mother is taking it. These medications can help so many different conditions, so it's not surprising. But recently, a celebrity singer sparked a new conversation. Can Ozempic cause osteoporosis? Since I specialize in rheumatology, lifestyle medicine, and osteoporosis treatment, let's break this down. You may have heard of Ozempic and Mounjaro, which are approved for diabetes, but also Wegovy and Zepbound, which are approved for weight loss. So what's the big concern here? Rapid weight loss can impact bone health. I have a lot of patients who are taking these medications on the side. Sometimes their physicians know about it and sometimes they don't. Sometimes it's prescribed and other times from a compounded pharmacy. Because of this, the results are sometimes good and sometimes not so good. And the reason for this is that they could be getting it from a place that may not have a pure product. There's no guarantee you're getting the right dose, the right ingredients, or that it's a sterile product. So some people end up with versions that don't work as well, or worse, cause unexpected side effects because of poor quality ingredients or incorrect formulations. It's kind of like buying supplements from a sketchy place. You just don't know what you're actually getting. But does Ozempic directly cause osteoporosis? Well, not exactly. When we lose weight, especially if it's rapid, we also lose some muscle mass. And studies are showing it could be anywhere from 30% to 40% of muscle loss on these GLP-1 medications. So why does this matter? Because strong muscles help support our bones. Less muscle means less mechanical stimulation on the bones, which can lead to bone density loss over time. Also, if somebody isn't eating enough protein or getting enough calcium, vitamin D, and the other nutrients, and if they're not doing resistance training, their bones may not get the support that they need. This combination can increase the risk of thinner bones like osteopenia or osteoporosis when they're really porous, particularly in people that are already at risk. So an interesting point that this singer made was that she has a history of eating disorders. And certainly if you don't build that bone at a young age because of an eating disorder, that's not going to help the situation. Bone mass is built primarily at your younger ages, and it peaks kind of in the mid to late 20s. If someone never builds strong bone, they may start adulthood with lower bone reserve, putting them at greater risk for osteoporosis later in life. Or it could happen to younger people if there is this perfect storm of not building bone, not eating well to nourish your bones, not doing weight and resistance exercises, which helps stimulate your bones, and ending up with osteoporosis or osteopenia early in life. So this means that severe weight loss or malnutrition when you're in your younger years or early adulthood can have long-term consequences for bone health. The good news is that not everyone is at risk for osteoporosis with these medications, but there are those that could be more vulnerable, and that's people that are losing weight too quickly or severely restricting their calories, those that are not prioritizing protein and strength training, individuals with a history of osteoporosis or low bone mass, postmenopausal women or older adults who naturally have lower bone density already, and those who didn't build enough bone mass in their earlier years because of poor nutrition or an eating disorder. So what can you do to protect yourself? Number one, ensure you do some resistance training, about 2 to 3 times a week. Number 2, ensure adequate protein intake. Protein helps preserve muscle and supports bone health. So a good guideline is around 1 gram of protein per pound of ideal body weight. Number 3, get enough calcium and vitamin D. And anybody that knows me knows that I prefer food sources if you can get them instead of supplements, because we really don't know how much they impact us and help. My caveat to that is vitamin D is often tough to get enough of, so you may need to supplement. And if you want to know more about how to get calcium through your food, you can watch this video. Number 4, avoid the extreme caloric restriction. Yes, you may not feel like eating, but at the same time, you do need calories. Just make sure they are good calories. And number 5, monitor your bone health. If you're at risk, consider a bone density scan. Very easy to get. It actually doesn't take long. People that are often claustrophobic, getting some kind of imaging done, this is not usually as tough as getting an MRI or some of the other scans. Talk to your doctor about personalized strategies. So if you pay attention to these different things, you can do well with these medications. One of the things that a lot of people report with these medications is that it turns off the food noise. And so they don't feel like eating, which is fine. Maybe you were eating excessive calories. But when you do eat this food, you have to eat nutrition-dense food. Don't be on the go grabbing fast food or ultra-processed food when you could be getting something that would be more nourishing for your body. This is also a good time to reconnect with people. Meal times used to be a time where you would spend with colleagues, family, friends, and it's a part of the process. But a lot of times with life on the go, you're just grabbing things to go, and that might not be good food for you to nourish your bones. So try to actually enjoy food and conversation. Eating mindfully can not only help with better digestion and satisfaction, but also ensure you're getting the nutrients that your body needs. So does Ozempic cause osteoporosis? Not directly. But if you're not eating enough, if you're losing too much weight, if you're losing too much muscle, and you're not doing resistance exercises, or if you have poor absorption for any reason, then yes, your risk of osteoporosis can go up. Then you might be putting your bones at risk. The key is to lose weight in a way that protects your muscles and bones. If you found this helpful, let me know in the comments. See you next time. Dr. B with Plant Forward MD.